This is All India Radio. We now bring you a special program on COVID-19. Good morning. I'm Anuja Kumar and with me is Subhadra Ramachandran. The headlines. Prime Minister Narendra Modi emphasizes on coordinated approach to fight COVID-19 at Non-Aligned Movement Summit. PM asks the global community to unite against countries spreading deadly viruses like terrorism and fake news to divide countries and communities. More than 1,000 people recover from COVID-19 in a single day. Recovery rate improves to 27.5% in the country. Several states relaxed lockdown norms as per Home Ministry guidelines. And 2 special flights to bring back stranded Indians from Dubai and Abu Dhabi on 7th of May. Prime Minister Narendra Modi emphasized on coordinated approach to fight against COVID-19. Speaking at the virtual Non-Aligned Movement Summit yesterday through video conferencing, he said the humanity is facing a major crisis in the wake of COVID-19 pandemic and NAM can contribute in dealing with it. He said the non-aligned movement can help promote global solidarity and it must remain inclusive.
Today, humanity faces its most serious crisis in many decades. At this time, the non-allied movement can help promote global solidarity. NAM has often been the world's moral voice. To retain this role, NAM must remain inclusive. In the post-COVID world, we need a new template of globalization based on fairness, equality, and humanity.
At the summit, the Prime Minister urged the global community to fight against the issues of terrorism and fake news.
Even as the world fights COVID-19, some people are busy spreading other deadly viruses such as terrorism, fake news, and doctored videos to divide communities and countries. But I want to focus only on the positives, on what we as a movement can do together to help the world fight this health crisis.
Mr. Modi said India is regarded as pharmacy of the world, especially for affordable medicines, despite its own needs during COVID-19 pandemic. He said during this crisis, India has shown how democracy, discipline and decisiveness can come together to create a genuine people's movement.
India accounts for 1/6 of humanity. We are a developing country and a free society. During this crisis, we have shown how democracy, discipline and decisiveness can come together to create a genuine people's movement.
A total of 42,836 fresh confirmed cases of COVID-19 have been reported in the country so far. Out of them, 11,761 patients have recovered after treatment and were discharged from the hospitals, while 1,389 patients have died. Briefing media in New Delhi, Health Ministry officials said that as many as 1,074 COVID-19 patients have recovered in the last 24 hours, which is the highest number of recoveries recorded in one day.
Total 11,706 लोग क्योर हो चुके हैं और अगर हम पिछले 24 घंटे में देखें तो 1,074 people have been cured. It is such a positive news that this is the highest number in terms of cured patient noted till date. और इसके साथ ही हमारा रिकवरी रेट अब देखें तो है बढ़कर 27.52% हो चुका है.
He said doubling time of COVID-19 cases has improved from 3.4 before lockdown to 12 days now. On the issue of on the issue of charging of train fare, he said the central government has not ever talked of charging train fare for workers. He said 85% of fare is borne by the Indian Railways and 15% by the respective state governments. The Home Ministry official said that the government has asked the states to ensure that there are no issues in interstate cargo movement. She said, in case of any difficulties, drivers and transporters can contact the Home Ministry control room number 1930 and NHAI helpline number 1033 to lodge any complaint pertaining to the lockdown.
गृह मंत्रालय और सड़क परिवहन मंत्रालय की ओर से सभी वाहन चालकों को बताना चाहूंगी कि अगर उन्हें अंतर्राज्यीय आवाजाही में कोई भी समस्या आती है तो वे टोल फ्री नंबर 1930 पर कॉल कर सकते हैं। अगर वे नेशनल हाईवे पर है तो वे NHAI के हेल्पलाइन नंबर 1033 पर सहायता के लिए कॉल कर सकते हैं।
During the briefing, Chairman of the Empowered Group 6 told how the group has been engaging with civil society organizations, NGOs, to combat COVID-19 and has mobilized more than 92,000 NGOs and civil society organizations, appealing them to assist states and districts in identifying hotspots, helping migrant workers and other needy people.
आरोग्य सेतु ऐप के साथ जो हम लोगों ने काम किया था उसमें अब टेलीमेडिसिन फीचर भी लग चुका है और करीब ये आरोग्य सेतु ऐप अब करीब 90 मिलियन इंस्टॉलेशंस इसके गूगल प्ले स्टोर में लग चुके हैं और ये अभी शॉर्टली इसका फीचर फोन ऐप भी निकलेगा।
Union Minister of Health and Family Welfare, Dr. Harshvardhan, reviewed preparedness and containment measures taken for the management of COVID-19 in Madhya Pradesh through video conferencing yesterday. He also discussed various issues with State Minister of Health Minister Narottam Mishra in presence with the senior officials from both centre and the state for the management on COVID-19. A report.
The Central Minister assured to provide full support to the State Government through National Health Mission for strengthening health systems as part of immediate and long-term measures. Dr. Harshvardhan also appreciated Indore administration and health officials for effectively utilizing both Sarthak and Arogya Setu applications. Madhya Pradesh Health and Family Welfare Minister requested the Central Minister to approve a proposal for relief package of Rs 1200 crore for COVID-19 infection control. Meanwhile, in another video conference, BJP President JP Nadda, Union Ministers Narendra Singh Tomar, Prahlad Joshi, Arjun Meghwal and Chief Minister Shivraj Singh Chauhan reviewed the situation of Indore with local MP Shankar Lalwani. Sanjeev Sharma, AIR News, Bhopal.
In Rajasthan, the number of people getting free from corona infection is increasing rapidly. 47% of the total infected patients found in the state have become infection-free so far. More from our correspondent.
1,438 persons in the state have been tested negative so far. 972 persons have been discharged from the hospitals. Corona cases have been reported in 29 out of 33 districts of the state. Meanwhile, 175 new cases of COVID-19 were also reported in the state yesterday. The number of infected persons has gone up to 3,061. The highest 89 cases were reported from Jodhpur. The number of infected persons in Jaipur has crossed 1,000. Chief Minister Ashok Gehlot has said that people should follow the guidelines issued for third phase of lockdown. Jitendra Dwivedi, AIR News, Jaipur.
In Himachal Pradesh, one fresh case of positive COVID-19 has been confirmed from Mandi district, taking the total number of active patients in the state to 2. So far, 41 patients tested positive for COVID-19 in the state. However, 34 patients have also been cured. One death has also been reported in the state due to the virus. Meanwhile, the state government is ensuring all possible help to the people of the state stranded in various parts of the country due to lockdown in the wake of COVID-19 pandemic.
The fresh COVID-19 positive case has been recorded after almost 10 days at Drubal village of Jogindernagar in Mandi district. In view of the infection, the entire area of 3 km radius from the village has been declared as a containment zone where no movement will be allowed, whereas 2 km area after that declared as a buffer zone where restricted movement will be permitted. Meanwhile, 2,553 stranded people of Himachal Pradesh have been brought back from Chandigarh, Mohali and Panchkula during the last 2 days. All these individuals are being medically investigated for anti-influenza-like illness symptoms and thereafter they are being allowed for home quarantine. Sanjeev Sundariyal, AIR News, Shimla.
In Gujarat, a total of 376 cases reported yesterday, taking the total number of cases to 5,804. 256 fresh cases were reported from Ahmedabad alone. With this, the city crossed 4,000 mark in terms of COVID-19 cases. Our correspondent reports that 29 deaths were reported in the state due to COVID-19 yesterday, of which 26 deaths were reported from Ahmedabad alone. The State Health Department said this is the highest single-day death toll so far.
Principal Secretary of Department of Health Dr. Jayanti Ravi said Solidarity trials are WHO-approved clinical trials related to COVID-19 which are being carried out in 100 countries. She said Ahmedabad-based Vijay Medical College has started the process for registering COVID-19 patients for the trials, while the process will soon begin in other 4 medical institutions such as SVP Hospital Ahmedabad, GMAS Medical College Vadodara, New Civil Hospital Surat and PDU Medical College Rajkot. The effects of 4 primary medicines which are used in COVID-19 treatment, including hydroxychloroquine, will be studied in the trial. She said results may help in studying various factors such as mortality, duration of the treatment, ventilator support, among others. Meanwhile, the state police has intensified vigilance in the red zones. DGP Shivanand Jha said there will be extra vigil on the movement of people during the night. The government has so far sent around 21,000 migrant workers to their home states by 11 special Shramik Express trains. Aparna Khun, AR News, Ahmedabad.
The Delhi government has imposed 70% special corona fee on maximum retail price of liquor in the national capital. The decision will boost the city government revenue, which has been hit due to COVID-19 lockdown. Uttar Pradesh government has launched special portal for the registration of those persons who are stranded in other parts of the country due to lockdown and want to return to their native places in the state. The website is jansunwai.up.nic.in, and anybody who wants to return to Uttar Pradesh or wants to go back from Uttar Pradesh can fill the details. We have a report.
Such kind of platform was the need of ours since many people were complaining that they have no proper idea that whom to contact if they want to return to their places. Now the persons who want to travel from Uttar Pradesh or want to come back to Uttar Pradesh will need to fill the forms on the website and provide the proper details. People will also need to provide the medical details of themselves and history, including the period spent in quarantine center if any. They also need to submit contact details of any persons at their destination and need to pledge that once they will reach at their native places, they will not have any objection in staying at quarantine centers. If any information was found wrong, then action can be taken against them under Epidemic Act. The registration on the portal itself cannot be claimed as permission for travelling, and whenever the competent authority will permit the journey, the person will be informed. The same service will be available on Android mobile phones from today afternoon. Sushil Chandra Tiwari, AIR News, Lucknow.
Union Minister of Rural Development and Panchayati Raj, Narendra Singh Tomar, launched the Saras collection on the government e-marketplace GEM portal in New Delhi yesterday. The Saras collection showcases daily utility products made by rural self-help groups, SHGs, and aims to provide SHGs in rural areas with market access to central and state government buyers. It is a unique initiative of GEM and the Deen Dayal Antyodaya Yojana National Rural Livelihoods Mission, NRLM. Under this initiative, the SHG sellers will be able to list their products in 5 product categories, namely handicrafts, handloom and textiles, office accessories, grocery and pantry, and personal care and hygiene. This is All India Radio bringing you a special news program on COVID-19. Let's take a look at the headlines once again. Prime Minister Narendra Modi emphasizes on coordinated approach to fight COVID-19 at Non-Aligned Movement Summit. PM asked global community to unite against countries spreading deadly viruses like terrorism and fake news to divide countries and communities. More than 1,000 people recover from COVID-19 in a single day. Recovery rate improves to 27.5% in the country. Several states relax lockdown norms as per Home Ministry guidelines, and 2 special flights to bring back stranded Indians from Dubai and Abu Dhabi on 7th of May. For quick news updates round the clock, follow us on our Twitter handle @AIR News Alerts.
Many states are implementing the relaxations announced by Ministry of Home Affairs for the 3rd phase of lockdown, which came into effect from yesterday. Certain activities have been permitted in green, orange and red zones with certain restrictions. These relaxations have been aimed at easing out the difficulties faced by daily wagers, migrant workers and other persons in distress. Telangana state authorities have taken up the task of bringing home hundreds of students who stranded in other states due to lockdown and sending migrant workers to their home states on priority basis. The activity began following relaxations announced by the Union Home Ministry. More from our correspondent.
Over 600 students stranded in Andhra Pradesh and Maharashtra due to the lockdown have been brought back home to Telangana in over 20 buses late last evening. They have gone to Nandyal town in neighbouring Andhra Pradesh state for coaching in bank exams before the lockdown. The authorities informed that after health checkups, those who have no symptoms of coronavirus will be sent to their villages for home quarantine for 2 weeks. Arrangements also have been made to bring back another group of 30 students who were stranded in Amravati in Maharashtra by buses. Meanwhile, the state government has announced that 40 special trains will be operated from the state every day for 1 week to send migrant workers back to their states. The trains will be operated from various parts of the state, including Hyderabad, Warangal, Khammam, Ramagundam and Damarchella to states like Bihar, Odisha, West Bengal and others. Police are issuing permission letters to those migrant workers who want to bear their travel expenses, and the migrants are leaving in private buses. Lakshmi, AR News, Hyderabad.
Karnataka state headed into the third phase of lockdown with a few relaxations on movement. People are allowed to travel in Bengaluru without passes between 7 a.m. to 7 p.m. Industrial activities, construction work, standalone shops commenced since yesterday. More from our correspondent.
The Medical Education Minister Dr. K. Sudhakar has informed that government will undertake a survey to collect health data of all the members of the family to help government implement various citizen-centric schemes. As a pilot project, it will be implemented in Chikballapura first. Union Chemicals and Fertilizers Minister Sadanand Gowda has helped a retired school headmistress in Bengaluru to procure life-saving drugs from USA for her daughter. Member of Parliament Tejasvi Surya had requested the Union Minister to help in this regard. The Municipal Corporation marshals have collected over 89,000 rupees yesterday from people found without mask in the city. A sum of 1,000 rupees is imposed as fine against people not wearing masks. Sudhindra, AIR News, Bengaluru.
In the Union Territory of Jammu and Kashmir, the district administration, Baramulla and Kashmir Valley, has been relentlessly trying to reach out to the rural people, especially the rural labourers in the district to mitigate their suffering following the outbreak of coronavirus pandemic and the prevailing lockdown. More from our correspondent.
In its endeavour to provide succour to the rural labour in the wake of COVID-19 situation, District Administration Baramulla has resumed a number of developmental works in rural pockets of the district under Mahatma Gandhi National Rural Employment Guarantee Act. Construction works in about 194 Panchayat Halkas out of 402 is in progress under the scheme. In all these Panchayat Halkas, about 3,160 unskilled labourers have been engaged, while monthly remuneration has been provided for about 312 works. Meanwhile, the Rural Development Department, Baramulla, has distributed about 5,24,000 masks in rural areas in an effort to prevent the spread of COVID-19. This is Sunil Koul for AR News from Srinagar.
Tamil Nadu has recorded an all-time high of 527 new COVID-19 cases yesterday, taking the total to 3,550. The single-day testing has exceeded 12,800 for the first time yesterday. Meanwhile, as a positive development, the hill resort town of Kodaikanal in the state has seen restoration of its ecosystem due to the lockdown conditions. A report from our correspondent.
The Queen of Hill Resorts, Kodaikanal, is breathing easy after the lockdown. The visual treat of a variety of colorful birds chirping merrily unfold quite openly now in the Hill Resort town. There are hundreds of bird species in the hills, each displaying the beauty of nature in their own style. They are all there out in the open, enjoying their newfound freedom. Even wild cattle loiter freely in the scenic public places that were unimaginable earlier. Herds of elephants are being seen cherishing and enjoying the absence of blaring horn of roaming vehicles in the lap of the foothills. As the people are homebound, the original inhabitants of the soil, like the animals and birds, come out open without fear and take leisurely strolls even in unusual places. If all join their hands to keep this pristine glory even after the COVID-19 pandemic ends, it would make the nature smile on all living beings, including the humans. With inputs from PTC Kamalakannan, Jai Singh, AR News, Chennai.
Defence Research and Development Organization DRDO has developed an ultraviolet disinfection tower for rapid and chemical-free disinfection of high infection-prone areas. The Defence Ministry said the equipment named UV Blaster is an ultraviolet-based area sanitizer designed and developed by Laser Science and Technology Centre. The UV Blaster is useful for high-tech surfaces like electronic equipment, computers and other gadgets in laboratories and offices that are not suitable for disinfection with chemical methods.
Government of India will operate 2 special flights from UAE to India on 7th May 2020 for those Indians who have been stranded in distressed condition due to the spread of the global pandemic. In a press statement, Consulate General of India in Dubai said that there will be 1 flight from Abu Dhabi to Kochi and the other from Dubai to Kozhikode on the 7th of May 2020 to evacuate the Indians who have been stranded in UAE for various reasons. Almost 2 lakh people have e-registered themselves with the Indian missions in the UAE to go back to the country in the last few days. More from our correspondent.
Speaking to All India Radio, Ambassador Pawan Kapoor said that the first list of the distressed citizens is being made. Priority will be given to workers in distress, elderly people, urgent medical cases, pregnant women, and others stranded in difficult situations. Amidst the global pandemic, the first evacuation flight is expected to take off on 7th of May, where there will be 1 flight from Abu Dhabi to Kochi and the other from Dubai to Kozhikode. The embassy and the consulate is in the process of contacting the people on the passenger list directly through email or telephone. The list is being made from people who had earlier e-registered on the website of the Indian missions in UAE. Maximum numbers of people have registered from the state of Kerala. The medical screenings of passengers would be done before taking the flight. Only asymptomatic passengers would be allowed to travel. The list will be given to Air India and they will issue the flight ticket on payment basis. Kanchan Prasad, AIR News, Dubai.
443 Lifeline Udan flights have been operated to ensure delivery of essential and medical supplies across the country. Civil Aviation Ministry said Lifeline Udan flights are being operated to transport essential medical cargo to remote parts of the country to support India's war against COVID-19, with special focus on the Northeast region, island territories and the hill states. A total of 821 tons of cargo have been transported to date, covering over 434,000 kilometers.
In an effort to guard against fake news being circulated on various platforms, we bring you our segment on fact-checking and myth-busters. Talking to AIR News, Dr. A.K. Varshne busted the myth that COVID-19 does not spread from eating non-vegetarian food products. He also advised to eat properly cooked food.
खाने की कोई भी चीज, चाहे वो वेजिटेरियन हो या नॉन वेजिटेरियन हो, चाहे मीट हो, मुर्गा हो, मछली हो या अंडा हो, उनसे वायरस नहीं फैलता। ये जरूर है कि जो भी भोजन आप करें वो अच्छी तरीके से पका हुआ होना चाहिए। कोई भी वेजिटेरियन या नॉन वेजिटेरियन फूड से ये वायरस के फैलने की कोई भी रिपोर्ट नहीं आई है और इसमें कोई भी सच्चाई नहीं।
In our series, Experts Speak on All India Radio, we bring you the views of some leading medical experts on COVID-19. Talking to AIR News, Dr. Uma Kumar, Head of Rheumatology Department AIMS, suggested to the people to follow social distancing, hand hygiene and cough etiquettes.
Corona infection, it's a new infection and nothing much is known about this virus. You call it treatment or you call it prevention. The only thing which helps is social distancing or physical distancing. Along with it, you have like hand hygiene, washing your hands very frequently.
President of Public Health Foundation of India, Dr. K. Srinath Reddy said India is in a much better position as compared to rest of the world as far as the COVID-19 cases are concerned and the measures taken are yielding results.
We started getting affected later than many other countries, but we are presently in a much better position than the rest of the world, and in that sense, we are better protected. However, we still have to watch how the epidemic advances before we can come to a judgment. But right now, it appears that our measures taken progressively from February and peaking with the lockdown are now paying dividends and showing results.
The News Services Division of All India Radio, in its bilingual live phone-in program today, will bring you a special discussion program on COVID-19. Listeners can ask questions to the experts on toll-free telephone numbers 1-800-115-767. Repeat, 1-800-115-767. You can also ask questions on telephone number 011-2331-4444. I repeat, 011-2331-4444. And post our queries on our Twitter handle @AIR News Alerts by #AskAir. This can be heard tonight on FM Gold channel and additional frequencies from 9:25 p.m. onwards. This program will also be available on our website newsonair.com and on our YouTube channel News on Air Official. You can also follow us on the News on Air app for updates.
Famous actress Raveena Tandon appeals to people to stay home, spend some time with family and follow government's instruction.
नमस्कार, मैं हूँ रवीना टंडन और मेरी आपसे अपील है कि इस वक्त सुरक्षा बहुत जरूरी है। इसीलिए जरूरी है कि आप और आपका परिवार घर पर ही रहें। हम घर पर रहकर किताबें पढ़ सकते हैं, फिल्में देख सकते हैं, घर के बच्चों के साथ खेल खेल सकते हैं और बच्चे भी ऑनलाइन ऐप के जरिए पढ़ाई कर सकते हैं। प्लीज चिंतित मत होइए। जो आपके रोज की सुविधाएं हैं जैसे किराने की दुकान और दवाइयों की दुकान, वो लगातार खुली रहेगी। अपने गवर्नमेंट और एडमिनिस्ट्रेशन की सुनिए। प्लीज बी सेफ, प्लीज स्टे एट होम। यही हमारी आपसे विनती है।
UN Secretary General Antonio Guterres said yesterday that blatant lies are being spread online at a terrifying rate, and the antidote to this pandemic of misinformation is fact-based news and analysis. In his remarks to high-level dialogue on press freedom and tackling disinformation in the COVID-19 context, the Secretary General said a recent analysis found that more than 40% of posts about COVID-19 on one major social media platform were posted by bots, automated programs disguised as people, he said. He added that the antidote to this pandemic of misinformation is fact-based news and analysis. It depends on media freedom and independent reporting, and it is rooted in a fundamental tenet: journalism without fear or favor.
World leaders, organizations and banks today pledged 7.4 billion euros for research to find a vaccine against the new coronavirus, but warned that it is just the start of an effort that must be sustained over time to beat the disease. The funds pledged at a video conference summit hosted by the European Union fell marginally short of the 7.5 billion euros being sought, but more money could arrive in coming days. Notably absent from the event was the United States, where more than 67,000 people have died, and in Russia. The home-to-home digital concert Eye for India, held to raise funds for the frontliners working round the clock to contain the coronavirus pandemic in the country, has raised an amount of over rupees 52 crore donations for relief. Facebook collaborated with some of the biggest names in the Indian entertainment industry, including Shah Rukh Khan, Amir Khan, Priyanka Chopra and Hollywood names like Mick Jagger, Will Smith and Sophie Turner for the fundraiser concert on Sunday. Besides singing and poetry reading, the celebrities addressed plight of migrant workers, daily wage earners, hunger in times of COVID-19, child abuse and domestic violence, both of which have been on a rise since the lockdown began. The concert had become world's biggest live fundraiser on Facebook, and all the proceeds will go to India COVID Response Fund, managed by Give India, to support on-ground relief.
And now an overview of today's newspapers covering COVID-19 stories. Army Chief pledges precise response to Handwara killings as Pakistan continues to push terrorists in Jammu and Kashmir, is reported by all the dailies today, including Hindustan Times. After being locked down, now companies set to suffer labour pain, notes the Economic Times, as workers rush home. India to bring back citizens stuck abroad from May 7, writes a pioneer. An Indian Express headline reports deepest cut in expenditure in the state of Maharashtra since the state was formed. The paper writes, coronavirus epicenter Maharashtra freezes all development spend for a year, no new hiring. Mad scramble as liquor stores reopen, writes a statesman, while Times of India says, city government slaps 70% liquor cess after a day of chaos at outlets. A headline in the Hindu side states with high swine flu rate record most COVID-19 cases. And finally, another headline in Hindustan Times says, use of Aadhaar enabled payment services doubles during the lockdown days.
And now, before we end the special news program on COVID-19, the headlines once again. Prime Minister Narendra Modi emphasizes on coordinated approach to fight COVID-19 at Non-Aligned Movement Summit. PM asks the global community to unite against countries spreading deadly viruses like terrorism and fake news to divide countries and communities. More than 1,000 people recover from COVID-19 in a single day. Recovery rate improves to 27.5% in the country. Several states relax lockdown norms as per Home Ministry guidelines. And 2 special flights to bring back stranded Indians from Dubai and Abu Dhabi on the 7th of May. And with that, we end the special news program on COVID-19.